Department of Health Services Centers for Medicare and Medicaid Services, CMS, develops evidence-based regulations to ensure the health and safety of those receiving home health care services. The evidence-based regulations assess the following areas: patient vulnerability, such as high-risk complex care, healthcare-acquired infections, restraint use, and the potential for falls. This home health care simulation competency toolkit was established so that home health care nurses can have documented on their files requisite competencies specific to home health care nursing. The home video that you are about to view demonstrates the proper assessment of a home health patient based on 4 of the Medicare requirements: home safety assessment, medication safety assessment, physical assessment, and care planning.
Is it okay if I have a seat here?
Yes.
Okay. Before I sit down, do you mind if I take go to your restroom so I can wash my hands?
Yes.
Okay. While I do that, do you mind gathering some information for me? I need your medication PO box, your insurance card, and your discharge papers.
Yes. Home safety promotes aging in place. The home environment often does not support independence for older adults experiencing age-related challenges. As you will see in this video, the home environmental features may become barriers causing disability, for example, narrow doorways or steps in the home, low bathroom commodes that hinder functions. There is evidence that frail older adults, particularly the oldest old, with highest risk for chronic illness and disability, benefit from home evaluations, home modifications, and assistive devices to improve function and extended living abilities.
Okay, I need to talk to you. Oh, thank you. You grabbed your PO box for me. There are some things that I would like to talk to you about in terms of home safety. And what I've noticed are a few things. I noticed that when I walked up to your front door, you have no rails. Okay. The other thing I noticed also as I walk up to the living room, you have carpet on your floor, carpets on your floor. It would be really good if you can either remove it or get some skid marks on some resistance carpet so you don't slide. Okay. Then as I'm walking to your bathroom, I notice you don't have any smoke detectors. Okay, one should be outside of each room, right before you get into your kitchen and your bedroom doors. Okay. Batteries are preferred, but if you can get the ones that have electrical wiring and batteries, would be safer. The other thing also, I noticed in your bathroom, you have no grab bars for your safety to hold on to. And also in your tub, you have no skid mark treads in your tub or floor mats. Okay. The other thing I want to talk to you about will be, then we talk about your fire alarm. I noticed that you had bars on your bedroom window. We really need to have you have release bars inside for emergencies. Release handles inside.
They do have release.
Okay, I didn't see that. My apologies. And also your front door, I noticed your deadbolts are on the inside, on the outside. So it should be the opposite way around, so you have the latch coming from the inside and the deadbolt on the outside. Okay, good. So now, you grabbed your pill box for me and your card, thank you. But you know, I need to see your medication pill bottles so I can see your trade and generic name.
Okay. My pill bottles are right up there in the cabinet.
Okay. Medication assessment is very important in home care, as the nurse is responsible for assuring that the patient is aware of how to take the medication correctly and that the patient is aware of the potential complications that may occur.
Thank you. You also brought me your over-the-counter medications as well. Very good. I really want to focus in on these three. You have metoprolol, you have losartan, and you have nifedipine. These three medications are in the same family, meaning that they all three will affect your blood pressure. So what I'd like you to do is, whenever you're going through your dialysis, to hold off on taking your medications, okay, because they may drop your blood pressure some more. Your nifedipine, I know this is topical, correct? Okay. Also, when you're using your nifedipine, I really need you to use gloves because it can absorb your skin and cause your blood pressure to lower some more. Okay. Your renal gel, it's a good medication here, but I need you to take it either 1 hour with meals, 1 hour before, or 3 hours after you take any other medications. Okay. And you have your Emeron. I noticed that's a cancer drug. I'm just going to kind of look this up because I'm not quite sure why you're taking this medication.
Okay.
Did your doctor explain to you why you're taking Emeron?
Yes. I have a sore on my finger,
Okay.
and that I have scleroderma.
Okay.
And so scleroderma sometimes tightens the skin
Okay.
and causes Raynaud's.
Okay.
If I'm saying it wrong.
Raynaud's, good.
And so that's why I'm taking the Emeron, it's for the Raynaud's.
Okay, and I see you are correct. Very good, very good. So it's not you're not using it for a cancer drug, it's
No.
for your Raynaud's. Okay, awesome. Very good. Do you have any questions for me so far?
Not so far.
Okay.
I pretty well understood what you told me and the safety tips. I'm glad to hear the safety tips because sometimes you forget.
That's quite all right. I'm going to leave you this VIP home health care checkoff list about basic home safety instructions, all the things that we've kind of talked about. The walkways, about removing the rugs because you don't have, they're not sticky, we don't want you to skid and fall. We talked about the stairs not having any rails, okay. Your furniture layout is pretty good, okay, so I'm just going to go ahead and continue checking some things off and highlight those things that are important for you. Okay, so Ms. Johnson, based upon your past medical history of cancer and scleroderma, of the renal failure, I need to take your blood pressure, but not in your right arm because of your scleroderma and not in your left arm because of your fistula. Okay? So I really need to take your blood pressure in your leg. So is it okay for you to go to your room and lie down so I can take it?
No problem.
Okay, awesome. Okay, Ms. Johnson, your blood pressure looks very well. We're going to go ahead and order skilled nurse once a week, time for 8 weeks. Okay. Social worker to assist you with home improvements. And I noticed when you were coming to your bedroom, you had this kind of like an unsteady gait, so we're going to go ahead and order some physical therapy for you as well.
Okay.
And also home health aid to assist you with your ADLs. Would that be okay?
Sure, that would be fine.
Okay, awesome.
PICC line dressing change can be a bit challenging, especially in the prevention of line sepsis and in the hospital setting. But in the home, it's a bit more challenging because we have more bacteria and we're not very familiar with the patient's home and what's sterile. So we really have to be really diligent when we're doing PICC line dressing change. After we remove the patient's old dressing, the thing we want to do next is make sure that we have our environment set up that we're going to use. We want to make sure that we don a mask so that if you're a talker like me, I have to give the gab, we want to make sure we don't insert any bacteria from ourselves into the patient. We also want to instruct the patient to make sure he turns his head away from the PICC line because we don't want to reintroduce any bacteria. We also want to make sure that we have everything in our sterile environment that we're going to use. So what I'm going to do here before I don my sterile gloves is put my vial patch in the sterile environment. My saline and flush and my clave do not have to go into the sterile environment, because as much as we believe that this packaged saline is sterile, it is not. And we don't put it in our environment. Now I want to don my sterile gloves. Now that I've donned my sterile gloves, it's important to maintain as much sterility to the line as possible. So I'm going to place a sterile drape underneath the line. Using the sterile drape that they have here in the 4x4, I'm going to open my drape and place it underneath the actual line. It's important to understand that after we apply this non-clean line on the patients, this drape is no longer sterile, but we still want to maintain as much sterility as possible. So there we have it. Now we can begin cleaning our line. Using ChlorPrep, it's important that we use a 3x5 area in an aggressive scrub. Identifying my left hand as my less dominant hand, is going to be my dirty hand. Applying pressure at the center of the line, I'm going to clean in an aggressive scrub in a 3x5 area for 3 to 5 seconds. I'm going to pull this drape down here because it's getting a little bit wet, and maintain my area. After cleaning the line with the ChlorPrep, we give a couple of seconds for it to dry. Place the ChlorPrep in our dirty area, and then apply our BioPatch. It's important to apply the BioPatch with the shiny side up, and not having it to cover the line. With our sterile hand, we make sure the insertion site is covered, and then we're ready to apply our transparent dressing. The last thing we want to do is cover the site with a transparent dressing. So we take our transparent dressing. The sterile part is underneath, so I'm still going to use my right hand as my dominant hand, and I'm going to apply it over the BioPatch, and our sterility underneath the line is secured, allowing this to stay on to adhere to the area. Now I'm going to clean my clave. This is not sterile, so now I can move my saline over here, grab one of my ChlorPreps that I picked up, and now I'm going to clean the hub around here to remove any crustaceans that might be there. It also helps to loosen the clave as well. So we have our crustaceans removed. I'm going to remove the clave connector, holding it downward so that none of the ChlorPrep actually goes into the line. Cleaning it for 3 to 5 seconds. I'm going to now take my new clave, remove the cap, attach it, and I can use a pulsating flush, and the line flushes with ease, no problem. Important to note what type of line your patient actually has. This is a Grosjean catheter. Grosjean catheters only have to be flushed with normal saline, not with heparin. However, if you have a open-ended type of catheter, those catheters may require heparin. It's important to assess what the hospital's policies are, and then proceed forward. But it's important that we maintain sterility of a patient's PICC line.